Hello everyone and welcome back to my channel, and in today's video we're going to be discussing the topic all about body dysmorphic disorder. So let's go ahead and get started.
And trying to remain so strong. I know it's good if I'm alone. I got it,
So before I get into this video, I just wanted to put a little disclaimer out there. I am not a health professional at all. I have had some health training, but I am not technically a health professional. I am just taking what's on the NHS website and I am putting it into a more easily digestible format. For any of you who want to listen or watch someone talk about something rather than have to read a load of information, but I will leave the links to any resources that I have found that I am then using to talk about in the description box down below. But let's go and get ahead and get started. So body dysmorphic disorder, or BDD, is when a person spends an overwhelmingly amount of time worrying about their body or their appearance, and this can be over-consuming sometimes. And sometimes, or in a lot of cases, body dysmorphic disorder is also accompanied by an eating disorder. Having body dysmorphic disorder does not mean that you're vain or self-obsessed. It actually kind of means the opposite. It means that you are consumed by the need to look a certain way, whether that is to be really, really buff and spend loads of time in the gym and get really muscular, or whether that's to have a certain part of your body look a certain way. It's more of a consuming thing for the person that is suffering with it rather than affecting other people. It can actually be very unnoticeable to other people. So you might have BDD, or body dysmorphic disorder, if you spend a lot of time doing these things, and this is when I go in to talk about the symptoms of this disorder. So one of the symptoms is you worry a lot about a specific area of your body. So for example, your face, and you might go, oh, my cheeks are really chubby, or I hate the shape of my nose, or something like that. But it's not always your face. You might spend a lot of time comparing your looks, not only to yourself and to your own body in the mirror, but also to other people, your friends, your family, loved ones, or people you don't even know, people on the internet, people like myself. I don't know, I'm not perfect, but some people may look at someone they watch on YouTube, for example myself, and they might say, oh, I really like this part about her, or something like that, and I don't have that. Another symptom of BDD is actually spending a lot of time looking at yourself in mirrors, or alternatively, avoiding mirrors, not having any mirrors around your house, and avoiding shop windows that might show your reflection and things like that. That might actually be one of your symptoms. Another symptom is spending a lot of time concealing your flaws, or what you perceive as flaws. So for example, you might hate your hair, and so you might spend a lot of time curling and straightening or doing things to your hair to make it look the way you want it to look. For example, you may hate your hair because it's really, really curly and you like it when it's straight. In that case, you may spend hours straightening your hair because that is one of your insecurities. I myself have never had to experience curly hair. I actually have dead straight hair, get out the shower, dry it, it's dead straight. And some people are jealous of that, but I'm jealous of people that have got a slight wave in the bottom of their hair, because I don't. I literally just have, I don't think I do anyway, but I literally just have straight hair, that's it. You may also spend a lot of time applying makeup, whether you hate your nose, so you want to make sure your nose is contoured really, really nicely to make it look a certain way, because makeup, when you actually do makeup professionally, what I've done today is nowhere near professional, but when you do makeup professionally, you may look at some makeup and you may be able to make your nose look proper, and say your nose is really long and wide, you may be able to make your nose look really long and skinny, and I don't know, people can do makeup and amazing things. I see them on TikTok in the transitions and I'm like, whoa, that was not that person, but obviously it was. But when you see those transitions and you're like, that's such a big change. And the last symptom that is on this sheet is picking at your skin to make it smooth or perfect. If you think you have body dysmorphic disorder, it is important to seek help. The first point of call within the UK and with us having an NHS is to go and see your GP to discuss your issues and to discuss what you want to happen. But when you do, you may be asked a number of questions about your mental health and how you view yourself and whether you've had any thoughts of harming yourself. These questions are normal questions that anyone with a mental health condition who's going for a mental health reason will be asked. So it's just a standard set of questions that they have to ask in order to make sure that you're not a risk to yourself. After that, you may receive treatment from your GP, or they may refer you on to a specialist or a support group or somebody who may be able and better suited to help you for your needs. I want to reassure you now that if you're listening to this video and you think you have a body dysmorphic disorder, or you know a friend who may have it, it's not a bad thing to ask for help. Asking for help is what saved my life. I I don't have diagnosed body dysmorphic disorder, but I have other diagnosable mental health conditions. And I find that since I asked for help and since I found someone that listens to me, it has helped me to help to save my own life. And I'm now 4.5 years into recovery, and if you ask 17-year-old me, would I even be alive today? I would say no. So asking for help can really change someone's life. One of the main treatments for body dysmorphic disorder is CBT. CBT stands for cognitive behavioural therapy, and CBT can help a lot of different things, such as personality disorders, eating disorders, and also body dysmorphic disorder. CBT is a treatment that helps you to change and challenge the way you think, and it helps you to realise things that you may think about yourself and change those negative thoughts into more positive ones. CBT for treating BDD will also include probably things like exposure therapy, where you will go and you will be exposed to certain elements that may challenge your negative thinking towards your body or towards your comparison between you and somebody else. This usually would involve facing your fears and putting yourself in difficult situations that might make you feel really anxious, but this will be done in a controlled environment or with somebody who knows and can help you to control your emotions in that situation. For example, if going out shopping is one of your fears, your therapist might take you shopping and support you in order to go into a shop and then ask you how you felt afterwards and help you to calm down if your brain decides that you're going to panic and you're worried about what other people think of you. Your therapist will then be able to manage and be able to help you to face these situations gradually on your own and without feeling self-conscious or afraid of doing a certain task. The second type of therapy that may be used for body dysmorphic disorder is SSRIs, or serotonin or selective serotonin reuptake inhibitors. This is a type of antidepressant which helps a lot of different other mental health conditions as well, but it can be known to help you with BDD. But it is important to remember that SSRIs can take up to 12 weeks to take an effect in your system. Usually the person with BDD is then taken off of the SSRIs as soon as they've not had either 6 or 12 months worth of symptoms and they feel very, very stable for 6 or 12 months. They usually will then be gradually withdrawn or weaned off the SSRIs. Children and young people can also be offered SSRIs to help to treat BDD, and this is only usually given to children and young people when they're suffering from a very severe form of BDD. And usually medicine is only suggested once other forms of treatment such as CBT are taken and tried. So now I want to talk about the causes of BDD and things that might cause you to have either a predisposition to having BDD or might make you more prone to it. So the first thing I want to talk about is genetics. So genetics play an important part in a lot of different mental health conditions. For example, me having a bad mental health past probably means that any of my children, if they get my side of that genetics, could struggle that way. And it's about me being prepared to be able to support them because, I don't have kids, but it's kind of knowing that genetics play an important part. For example, some mental health conditions are caused by genetics, for example, bipolar disorder, whereas something like PTSD isn't necessarily caused by genetics. You may be more prone to have it because of your genetics, but in order to get PTSD, usually you have to have some sort of traumatic event, which if you don't have, then you are not going to have PTSD. The other one is a chemical imbalance in your brain. So a lot of mental health conditions can be caused by a chemical imbalance in your brain. And going back to the whole bipolar disorder, that actually is a chemical imbalance in your brain and is treated with medication to help to sort out that chemical imbalance, which is why I believe, this is my opinion, but I believe if there's a chemical imbalance in your brain, that's why SSRIs might be suggested for this condition. And you may also be more likely to develop body dysmorphic disorder if you've had a traumatic event in your past, because body dysmorphic disorder can revolve around a trauma. For example, if you've been bullied about your weight or your appearance, this can then cause your brain to then think in a way that would be consistent with BDD. So now I want to have a look and talk about other things that may help you when it comes to having BDD, thinking you have BDD, knowing you have BDD, all these sorts of things. And the first one is support groups that are specifically for body dysmorphic disorder. There is a list on the link that I will leave in the description box down below because there's a lot on this list and I do want you to be able to look through all of them without getting overwhelmed by the amount I'm going to list off. So I definitely will leave this link, so don't forget to click on that. It will take you to the NHS page, which will then give you all the information that I have talked about and more. But one of the things that can help people with BDD is a support group from Anxiety UK. You've got Mind, you've got International OCD, OCD Action, all those different groups or charities. They actually can provide support for people with body dysmorphic disorder. Looking after your mental well-being can also be very important when thinking about BDD and people who have body dysmorphic disorder. So for example, having regular exercise and making sure you get enough sleep are two of the main things that help most mental health conditions. Some people find that they need to get in contact with mental health professionals or a therapist in order to recover from body dysmorphic disorder. However, some others, with the support of family and friends, can do it without the need from health professionals. Whether you've come across this video and you're supporting me because you know me and you know my channel, or whether you've clicked on this video because you or somebody you know suffers with BDD or thinks they might, then thank you very much for watching, and please don't forget that I believe in you even if nobody else does. And I shall see you in my next one. Bye!
Just like you're young again. No, don't you cry. Just get back up again.